of nowhere. Remember where that comes from. That comes from the company CEOs who are writing press releases and making statements, not for you or not for me, but for the shareholders. But the fact is, this is a decade-long development program that's been, going on a long time. And so what you're hearing about is from the company CEOs is more of a culminating event from a lot of hard work that went in for the last 10 years rather than something that sprang out of nowhere. But, this has been one of the problems with Operation Warp Speed coming out of the federal government is, well, first of all, the name Operation Warp Speed was a terrible name. The minute I heard that name, I said, my God, what are they doing? This is going to create a lot of confusion and turn a lot of people off. And then they didn't have a communication strategy. They left it to the company CEOs who only piled on a lot of misinformation. And this, we've been playing catch up ever since. So the program has been a decade long in existence. And then we've had the clinical trials underway. And I think the other thing about the clinical trials we have to remember is these are really large, well-done clinical trials in 30,000 people for the Moderna vaccine, 44,000 for the Pfizer vaccine, very carefully done, a lot of scientific rigor and integrity. The only piece that's really warp speedy is the fact that once we had the results showing that the stuff worked, the question then is, then what? Because usually when the FDA licenses a vaccine, they want to collect a full year of data to determine length of protection for the vaccine and to confirm all of the safety findings. And the problem there is if they waited a full year, you do the math at 4,000 deaths a day times months and months and months, you could be looking at a million lives lost. And nobody want that to happen. So that's why they released the vaccines through emergency use authorization, so we can get them ready to start vaccinating the American people now, knowing that we're still going to follow up with safety and everything else. I mean, the good news is in those 44,000 person trials, 30,000 person trials, there were no really common adverse safety events. It's not to say that there aren't going to be rare ones as you scale up from 44,000 people to millions of Americans. Other safety events may emerge, but they're not going to be common. They're going to be rare. I think the one thing that's happened that's a little higher frequency than I would have thought is the severe allergic reactions. Usually for the flu, influenza vaccine or HPV vaccine, it's around 1 to 2 per million. For the measles, mumps, rubella vaccine, it's about 1 per 300,000. With this one, with the mRNA vaccines, at least the Pfizer one, it looks like, and probably the Moderna as well, it's more like 1 to 50 to 100,000 for a severe allergic reaction. So still a rare event, but a little more common than some of the other vaccines that we're used to, and that's going to have to be managed as well. So the key is now scaling this up and waiting for and hoping the other vaccines will follow.
And so as far as both of them have high efficacy, what are the main differences between those two
There's
vaccines?
really not, I mean, they're more similar than they are different, right? It's they're both mRNA and a lipid casing. They both work by the same way. They get taken up by your cells. By the way, they never go into the nucleus of the cell, so it's not as though it's genetically modifying your DNA. So one of the big anti-vaccine tenets is that they say they're creating this term they use called genetically modified humans. It's garbage. We have a very aggressive anti-vaccine lobby, which unfortunately really began in Texas starting in 2015. And that's when it really started accelerating. It was linked to the extreme political right, and under this banner of health freedom, medical freedom. And that's when you saw groups like Texans for Vaccine Choice form. And they're very aggressive, and they throw out a lot of misinformation and disinformation. One of them is that vaccines genetically modify our DNA. They don't. It's RNA, not DNA. It doesn't get made into DNA and doesn't get taken up by the nucleus. But that's how they both work. They get made into protein by our own body's cellular machinery, And then that gets expressed to the immune system, and you create a very vigorous antibody response, what are called virus neutralizing antibodies. Now, one of the things it does do is it does stimulate a lot of inflammatory response in your immune response, and you feel it. So after I got my first immunization, I got the Pfizer vaccine. I felt sort of body aches and a muscle pain at the site of injection for about a day, maybe even a low-grade fever. And then after the second injection, I was fine for about 24 hours. Then I started having some shaking chills for a few hours at night that I took Advil for. So it's more than the usual vaccine, although my Shingrix vaccine was pretty bad as well, but overall tolerated it quite well. And that's going to be the case for most people.
Okay. And so for the trials, I mean, we know that the vaccine has been affecting certain populations, particularly those of color, disproportionately. Were the trials adequately reflect the diversity of the country? 'Cause that's one concern that a lot of people of color have.
Yeah, in the beginning, no, but the companies responded to that criticism and they quickly became more inclusive. So Pfizer actually expanded their 30,000 person study to a 44,000 person study. And you're absolutely right. I mean, the big concern that I have among the Hispanic and African American communities is there's a higher hospitalization rate. Well, first of all, it's a higher exposure rate living in, especially when you live in low income neighborhoods. You know, you're not working from home via Skype and Zoom, right? You're in family owned businesses or on construction sites. So you have, you're essential workers. So you have a higher rate of exposure. And then the hospitalization rate seems to be higher. And the really scary part is the way the deaths are occurring in the African American and Hispanic community. And among non-Hispanic whites, according to the Centers for Disease Control, 13% of the deaths are under the age of 65. But in the African American and Hispanic communities, it's 30 to 35%, so 3 times higher. And so that's the worry, right? It's all these mothers and fathers in their 40s and 50s, early 60s that are getting hit really hard. And that's why I didn't like that 65-year-old age cutoff. I mean, that's,
Mhm.
if that doesn't apply to the Hispanic and African American communities. And I actually think the state made a good decision about opening it up to people anyone over the age of 16 with underlying comorbidities. I think that captures a lot of it, but that's the real worry.
Okay. And for the vaccine, folks have been asking about whether it actually reduces the chance of if it's just reduces the chance of contracting COVID-19, or does it just make symptoms milder if you do contract it? And can people still be a carrier of it if they've been vaccinated?
So we don't know all the answers. Here's the way the trials were done. If you were enrolled in one of the trials, if you started feeling sick and there was a list of symptoms to look for, everything from cough to fever to, body aches, fatigue, you were tested for COVID. And if you were found to be positive, you were a case. So therefore, the trials only looked for people with symptomatic COVID and severe COVID. And we know there's 95% protection against symptomatic and severe COVID, which is great because now if you get vaccinated, once you get your 2 doses, you will not go to the hospital with COVID. You will not go to the ICU with COVID. It'll save your life. And that's really important. What we don't know yet is whether it stops asymptomatic infections. And the Centers for Disease Control find that about half the COVID infections are without any symptoms at all. So it's possible that you're still carrying the virus for a period of time after exposure and shedding it in your nose and mouth and infecting others. So, but I think that probably doesn't happen. I think the vaccine does have an effect on stopping asymptomatic transmission as well. We just don't have the data to support it. So that data is forthcoming. Their clinical trials are underway to specifically look at that. But in the meantime, the thinking is if you're vaccinated, you potentially still could carry the virus and transmit it to others. So let me give you an example. So I was vaccinated before the rest of my family was. So when I was first vaccinated, potentially I could be, if I was out and about in the community, I could be infected, be asymptomatic, and bring the virus home to my wife and infecting her who was not vaccinated. So as a consequence of that, even after I was vaccinated, I really didn't change my behavior at all. I was still mostly, working from home and taking lots of precautions. And until we kind of sort that out, that's going to probably be the case.
And I think that's a good point. And just for clarification, because there have been some reported cases, right, of folks who have received maybe one dose of the vaccine, who have then tested positive for COVID-19. Can you explain that to folks, why that's the case?
So when you looked at the early clinical trials, one of the things that we learned over the last 10 years is that to make an effective immune response to COVID-19, you needed to get what are called high levels of virus neutralizing antibody. It's a type of antibody that binds to the virus and prevents the virus from replicating or binding to our host tissues. And what I noticed for all the vaccines, pretty much, except maybe the Johnson & Johnson vaccine, is you needed 2 doses in order to achieve that high levels of virus neutralizing antibody. So I started to say, you know what, this is not going to be a single dose vaccine. We're going to have 2 doses. After the trials were done, people looked at some of the data and noticed that there was some level of protection more than expected, even after getting a single dose. But it's not very consistent. It may not be very durable. So that's why we're still going to need 2 doses. So the point is, even after you get a single dose, the level of virus neutralizing antibody in your system may not be enough to confer protection. So, once you get a single dose, you still have to behave as though you weren't vaccinated, at least for the following month until you get, or 3 weeks, depending on the vaccine, to get the repeat dose.
And so I would say then it's very important for folks not to just say, oh, well, I got one dose and yeah, I'm not going to go and get my second one, because that's not
Get
really
get
giving them that level
get
of
get
protection.
that second dose. And unfortunately, there's a lot of press now about all of these people who want to, in order to save doses, are saying, let's just give 1 dose to the American people and we'll worry about the second dose later. And I've really pushed back hard against that, saying it's a really bad policy because we have no idea of the level of protection for that 1 single dose. And now the FDA has come out with a statement agreeing with me. And then Tony Fauci agreed with me. So I got that going for me. So that's really important.
Okay, so let's move on a little bit to talk about some of the safety and side effects of the vaccinations. Do you, or of the vaccines, do you know of any of the short or long-term side effects of either of
Well,
them? And there are rumors about them causing Bell's palsy and that sort
yeah.
of
So
thing.
the clearly, when you get immunized within 48 hours, you can feel sick. You can feel like you have a fever. You can feel like you may actually have some fever and arm soreness and muscle aches and pains. And that can happen with any vaccine. I mean, it certainly happened when I got my Shingrix vaccine for zoster, but it can happen with any vaccine. It tends to be a little more frequent with these. So that's something to keep in mind. Severe allergic reactions are still really, really rare, like 1 in 50 to 100,000 roughly. So, but it has happened. So that's why now they're asking people to wait around after you've been vaccinated for 15 minutes to make certain you don't have any untoward reaction. I think that's really important. So that's the short term. This idea of Bell's palsy, what that is it's a weakness of the facial nerve, so that you have a droop on one side of your face. And there were a few cases noted in the group that got vaccinated, over 40,000 people, and there was even 1 or 2 in the placebo as well. So the point is, Bell's palsy is something that occurs in people from time to time. It's a rare event, but it does occur. It looked like it's a little more frequent in the vaccinated group. It usually tends to be temporary and then resolves, but it's still a rare event. There was a vaccine produced by a Swiss company about 10, 15 years ago for flu, where you gave the vaccine through the nose, an intranasal vaccine, and that was clearly associated with facial palsy. So it's possible this one does, but it's again pretty rare. But of course, you got this whole aggressive anti-vaccine lobby that's really playing this up, and then they're digging up any picture on the internet they can find of somebody with Bell's palsy, and you know how this works, right? They're saying this person got it and now he's ruined for life, and it's really unfortunate they're doing that. So it may occur with a higher frequency among the vaccinated group, but a rare event and usually temporary.
Okay. And what about adverse reactions for certain people, or kind of thinking about people who shouldn't take the vaccine? Like if you have allergies, HIV positive and immune suppressed folks, autoimmune diseases, high blood pressure, diabetes. I mean, is there any disproportionate impact on those
Well,
folks?
remember, most of the vaccines are meant for people with underlying conditions because you're at greater risk of getting severe COVID. Right now, remember for the first two vaccines, the Moderna and Pfizer, these are non-live virus vaccines. These are mRNA vaccines. So even if you're immunocompromised, you should be able to take them. Um, the only specific contraindication for getting these vaccines is if you're known to be allergic to any of the specific components in the vaccine. And so far, the only one that may be a specific problem that we think is there's a substance in the vaccine used to stabilize it called polyethylene glycol, or PEG, PEG, and it's used sometimes as a food additive and things like that. And some people are known allergies to it. If you have known allergy to PEG or any of the vaccine components, then you shouldn't take it. But that's a really, really small number of people. My wife's on Humira, takes Humira. Yeah, absolutely, she should get the vaccine. Even people who are immunocompromised, HIV/AIDS, there's no reason why you shouldn't get the vaccine. You should still go ahead and get it. Um, then the question comes up, what about pregnancy or breastfeeding? Now, for pregnancy, if for the clinical trials, people who were pregnant were excluded who knew they were pregnant were excluded from participating. However, during the trial, several women became pregnant after vaccination, and they did fine. There were no issues. So the right now, there's not that hasn't really been specifically studied in pregnant women in terms of fetal outcome and other measures. But given the fact that COVID-19 can produce such severe disease during pregnancy, so pregnant women who get COVID-19 do not do well. They have very high rates of hospitalization and ICU admissions and even deaths. So the risk of being pregnant and and what happens if you get COVID is very high. It's like having almost like an underlying comorbid condition. So you want to get vaccinated. And now the ACOG, the American College of Obstetrics and Gynecology, is recommending that pregnant women get vaccinated, and the Society for Maternal Fetal Medicine is recommending that pregnant women get vaccinated. And then for breastfeeding, there should be no issue at all.
And so just a couple more along those lines. So folks, if they've had a allergic reaction to the flu shot, or a severe allergic reaction to the flu shot, or other medication allergies, and I think someone said, what if you're on blood thinners, or
Should be
what if I'm
okay.
in?
All those things should be okay. But if you have any questions at all, I mean, this is why you have a doctor or a healthcare provider have that conversation. Because
Mhm.
remember, the risk of what happens, there's so much COVID transmission right now. It's really at a screaming level. That's a big risk. And so you want to protect yourself against COVID.
And so you already talked about the half dose conversation. So hopefully those are we're not dealing with that. But it sounds like you're saying that there's no reason right now, unless you're allergic to a specific component of the vaccine, not to get vaccinated.
That's right. That's
Okay.
right.
And I'm going to go to just making sure other
And by the
questions.
way, there's going to be other vaccines that follow. So
Yeah, that was the question.
so that's another thing to realize, that that's something we're going to have to begin looking at, is the other vaccines. And the next one's probably coming up. The adenovirus ones are live virus vectored vaccines. The one from AstraZeneca Oxford and the one
Mm-hmm.
from J&J. So they're immunocompromised individuals. We'll have to see what the data says and what the FDA recommendation is going to be.
Okay. And do we have a timeline on when those, do you know where they are in the trials? And
I'm hoping by next month that we'll have at least one of them, because we're going to need those vaccines to vaccinate the American people.
okay. Um, we're going to get to some of the rumors in a little bit, but first, do you know about? So most of these, I think, for one vaccine, it's 16 and up, and then for the other, it's 18 and up. Do we know where we are in the process of developing one for children?
So all of the vaccines eventually will be tested in first in adolescents and then in children, because to get to 3/4 of the U.S. population vaccinated, we're probably going to have to vaccinate at least adolescents and maybe younger children as well. So those clinical trials are now underway, and hopefully we'll get some answers in the next few months regarding both efficacy and safety. The hope is, I think, that we can have kids vaccinated in time for the fall school year this year. I think that would be the best. I mean, the most important for me is protecting the teachers and the bus drivers and the school staff and the parents, because they're the ones at greatest risk. But we still see some adolescents and kids get severely ill, so getting them vaccinated is going to be important.
And then what about the looking at more safety? What is are we thinking that it's about 75% of the community needs to be vaccinated in order for it to be, I guess,
I
to
think
create
so.
that herd immunity?
And as I say, that's a high bar. So let's say, we're talking about 3.6 million residents of Harris County. So, let's say we want to do it over 6 months. That's which would be really aggressive. That would be 600,000 a month. So 20,000 a day. So, and we just don't have that bandwidth, right? I mean, the problem now is, it's still all about calling HEB and seeing if there's vaccine for your mother or father, or calling, Kroger's or Randall's or CVS or Walgreens. That's not the way to do it. I mean, now we're starting to get the health centers and the city health centers up to speed, which are great, because especially for the low income neighborhoods, a lot of them are pharmacy deserts and supermarket deserts. So having the community health center is going to be really important, the hospitals. But even with all that in place, I'm concerned it's not going to be adequate. I think we're going to have to do something bigger. And I saw the mayor tweeting about opening up Minute Maid, not as a mega center, but as a larger place to get a lot of people vaccinated. And I think we're going to have to start doing things like that, because we need high throughput. Because remember, we've sort of punted on every other approach. We really haven't, especially here in Texas, where people have been very defiant of social distancing and even masks. And as a consequence of that, we're backed into a corner. So vaccinating Texans has to be a big priority.
Okay. Um, just how long does it take for you to develop immunity after your second dose of these two shots?
Roughly about a week after the second dose.
Okay. All
So
right.
I got vaccinated, my second dose on Tuesday. So the hope would be after this weekend, that's my get out of jail free card. I'm immunized, um, but not everyone around me, so that's still problematic.
And should you continue wearing a face mask even
I
after you have your second dose?
I
And
will. So if I've been mostly working from home. I'm going to start going into the office a couple of days a week, and I'll still have my mask on, while I'm in the office. Maybe if my door's closed in my office or I'm on a Zoom call, it'll be off. But generally, as I walk around the hallways at Baylor College of Medicine or into the lab, I'll have my mask on.
okay.
And then as more and more people get vaccinated, And we actually show evidence of interrupting transmission. Eventually, by towards the end of this year, the masks will come off. And
Okay, good. And I'm going to
let me
go
give you
into.
let me give you another. So now my wife Ann got her first dose of vaccine, and she's waiting for the second. And when she gets her second, she has her mother lives up in New Jersey. She hasn't seen her in a year, so because no one's traveling, so she's going to visit her. But she hasn't been vaccinated yet. So what do you do? So she's going to, well, one is either to wait till she gets vaccinated, but even if she does, while she's on the plane or going through airports, she'll have the full mask on and everything else. And so this is the kind of way to think things through. And it gets confusing for people because people understand what to do after we stop transmission. People understand what you do before the vaccine came along. But during this interim period, there's a lot of confusing elements. But the bottom line is, when you're out in public, even if you've been vaccinated for now, just behave as the same way as you did if you weren't vaccinated.
I want to talk a little bit about some of the disinformation and misinformation out there. Um, Social media posts talking about microchips and magnetic links. Is there any truth to that in the
Yeah,
vaccines?
none. So the microchips would be too big for the 25 gauge needles that are used for the vaccine. That's one point. And there's just a lot of conspiracy theories out there. It's me or Bill Gates or Tony Fauci. We're sticking microchips into people. And there's one that says that I'm doing this with Bill Gates and Tony Fauci in a special secret lab out in Area 51. And, you just couldn't make this stuff up. It just goes on and on. But, the amazing thing is a lot of people believe it. So, and the problem is we don't have a good system of communication to counter it. So the sort of the fight I've been having with the HHS agencies and the federal government is, they're all about, okay, we got to fine tune the message. We got to deliver the message. We got to do public service announcements. And that's, I said, that's all great. But that in itself is not going to be adequate because the anti-vaccine lobby is so aggressive. They dominate the internet. If you go to the Amazon.com website, and I know everyone's done this. If you put books up at the top and you press return, you'll get a scroll down menu to the left, and scroll halfway down the page, to health, fitness, and dieting. You click on that, you'll get another scroll down menu that says vaccinations. You click on that. It's all fake anti-vaccine and COVID conspiracy books. So this is what people are reading. This is what we're inundated with, the disinformation. And it's, so I'm of the opinion that we've got to start taking down some of this stuff. The other piece to this, talking about the African American community, some of the surveys, including surveys we've done, have shown a very high rate of vaccine hesitancy or resistance in the African American community. And the reasons ascribed to it are historic and structural racism. And I get all that. But, up until couple of years ago, I've never really thought of the African American community as so defiant against vaccines. To me, this is something new. And I started to look into it. And one of the things we've realized is the anti-vaccine groups have been specifically targeting the African American community. So they did this with the Orthodox Jewish community in 2018. They started, writing these pamphlets and doing town hall meetings with Orthodox Jewish community leaders saying that vaccines are the next Holocaust, very inflammatory language, right? And they caused that measles epidemic in the Orthodox Jewish community in New York in 2019 that landed 18 kids in the ICU. Then those same anti-vaccine groups started staging rallies in Harlem, anti-vaccine rallies. And a lot of it was led by Robert F. Kennedy Jr., who heads this anti-vaccine group called Children's Health Defense. They even organized a rally in the Riverside Church, which is one of the iconic churches of the civil rights movement. Reverend Sloan Kaufman was, a huge civil rights champion. And so I think some of this, I can't tell you which component of it, is due to deliberate targeting of the African American community. And you know what language they're using, right? So they use Holocaust language for the Orthodox Jewish community, for the African American community. It's all about Tuskegee. Vaccines are the next Tuskegee experiment. And up until recently, you never heard that coming out of the African American community. It's only in the last couple of years. And I think a lot of this is deliberate targeting by the anti-vaccine groups. And it really gets me angry. So I'm trying to, launch this counteroffensive. And, I've been trying to talk on some of the African-American radio shows. I did one in Chicago a couple of weeks ago. I think I'm doing one tomorrow morning. In fact, it's, hold on. I think it's with the Texas Southern, their radio station. Let me see if it's, maybe you know it better. Live KTSU radio, Saturday morning at 7:20. Guy named host Donna Franklin and Chris Johnson invited me for tomorrow morning, and I'm going to go on that. Because I'm really worried. We're seeing a lot of, even among African-American healthcare providers, you're seeing a lot of resistance. So we're seeing this, and there's such risk, especially if they're working in ICUs and emergency rooms. So this is going to be a real challenge.
Agreed. And just a quick point, being an African American, and I do understand that I have a higher rate if I contract COVID of dying
right.
than my Anglo counterpart.
2.8 times hospitalization.
Yeah. And so I'm like, I do not need COVID. And then when we talk about some of those healthcare disparities, a lot of times when it's targeting the African American community, it's because things are being withheld from us. Even when you look at Tuskegee, it's like they withheld the cure for the syphilis, right?
That's
it wasn't
right.
that they
That's
were just
right.
doing all this. They wouldn't give it to them. They knew
That's right.
what would
That's,
they knew what would
it.
help them and wouldn't give them. When you think about pain medications, the data today talks about, okay, well, African Americans aren't given the same level of pain medication, to relieve their pain. So that's a lot of what the disparities are that we're dealing with in healthcare for the African American community, is withholding from us. And this vaccine, across the board, it's saying it's there for you. It's available. It's available for me. It's available for you. So, yeah,
you know what? I'm going to use that tomorrow morning. That's I'm totally stealing that from you tomorrow morning.
Please take it because I deal with it, even though my sister is big in vaccinations, family members. So, well, I know that you're headed to another appointment, so we're going to wrap this up. I'm trying to get to as many questions. I'm sorry, folks, we will post a recording on this if it's okay. With Dr. Hotez, but someone's asking, okay, just to make sure, yes, you need to get both doses of this vaccination. Do not stop at one dose. You need to get both. If you do contract it after the second shot, then you will most likely not be hospitalized, and it will be milder symptoms.
It'll save your life. It'll save your life.
It'll save your life. And is it something that we're going to have to take annually?
So we don't know. We don't know. Because we had to release it after a couple of months of data. We don't know how durable the protection is. So that's an unknown. Is it 3 months, 3 years, 30 years? And it may not be the same for the Pfizer or the Moderna vaccine. So we don't know which one is which. So what I've been saying is, look, don't cherry pick it. Don't, wait to say, okay, this is the vaccine I'm going to take. Take what you can get. And if it turns out the vaccine you got is not the most durable, you know what? Get a boost later on, a third dose, either with the same vaccine or a different vaccine. But that's, another really important point. The level of communication we're going to need around this is unprecedented, because there's a lot of stuff's going to come up. A lot of things are going to happen. And so people need to be informed, and we don't have a good system in place yet for that.
Yeah. Okay. Well, I don't want to keep you and make you late for your next appointment, Dr. Hotez, but we are so very grateful. We know how busy you are. Thank you for taking the time to spend with us.
Thank you for doing this and getting the word out. By the way, if people want to email me, they're more than welcome to. It's just my last name, Hotez, at BCM. It stands for Baylor College of Medicine.edu, Hotez at BCM.edu.
Wonderful.
And
Thank you.
I'm not as quick on the draws I used to be for answering emails because of all the craziness, but eventually I'll try to get to it.
Okay. I just put that in the chat. So thank you again, Dr. Hotez. And for everyone else, we will be sending a recording of this because I'm not great with technology. It started a little late, but there's plenty of good information in there nonetheless. So thank you all and have a great morning.
Thank you so much.
Thank you. Take
Bye
care.
bye.